Good afternoon. Ready to call the Community Advisory Committee to order? And I believe we've established a quorum. Okay, I'm Miley Foster representing El Paso County. And we'll see who else is here in the flesh. And we also have a good crew online. So
I'm Gary Sugar, I guess a citizen at large.
Microphone in.
Ed Esch, Green Mountain Falls.
And I'm Patty Benja representing City of Colorado Springs.
welcome. And then how about we start online? I can't.
Sharon
read.
Brown, Sharon Brown, City of Fountain.
Okay, next.
Paul Wiggins, citizen at large.
Thank you.
Tony Sultana, El Paso County.
Thank you.
Bill Bowles, Park County.
Welcome.
Shelley Roars, League of Women Voters of the Pikes Peak region.
All of our committee members.
Okay, everyone else, we're going to probably hear from. Okay, so next up on the agenda is consent items. The agenda, the minutes, and the financial reports can be acted on as a whole. So do I have a motion to accept the consent items?
Patty Benja, I make a motion to approve the consent items.
Sharon Brown, I second.
Any discussion? All those in favor of the motion to accept the consent items?
Aye.
Aye.
Any opposed? Thank you all. The consent items are accepted. Do we have any public comments? Were there any from email?
We did not receive any public comments in advance of the meeting. Anyone online?
Guess not. Well, then let's start with the information items. 4A.
This is the Area Agency on Aging Senior Insurance Program with Roma Costanza, who's going to come up to the podium and talk to us about the SHIP program. And
there we go. All right, good afternoon. Thank you for giving me a few minutes of your time. My name is Roma Costanza. I'm with the Area Agency on Aging, obviously, and I am the coordinator for the SHIP program, which stands for State Health Insurance Assistance Program. Within the Area Agency on Aging, the State Health Insurance Assistance Program is a federally funded program that provides free, unbiased information and education on all things Medicare. This is a program that is available across the country. Every county and every state has access to a SHIP counselor. We are trained and certified by Medicare directly to provide, again, information and education to beneficiaries, family members, caregivers, any interested parties. We provide outreach and education services within the community to include public presentations. So I do multiple Medicare 101 presentations throughout the year. We also do one-on-one counseling with beneficiaries and consumers, either by phone, in person, email, one-on-one Zoom appointments online. The SHIP program in the Area Agency on Aging here serves a total of 9 counties in Colorado. So of the 17 SHIP programs that are in Colorado, most of these programs serve multiple counties in their region. We also provide information and assistance for people who have low or limited income, for financial assistance programs with or associated with Medicare, for Medicare premiums, and for Part D benefits. So we can screen and assist with applications for those programs. We also do outreach to partners within the community or within our 9-county region. And we partner with several local community partners. For example, our Medicare 101s, we partner with the Pikes Peak Library District, who hosts those 101s for us. We've also done educational presentations and partnerships with Colorado Springs Utilities and PARA, Public Employees Retirement Association. As a SHIP program and for our region out of this office serving 9 counties, we are one of the highest volume SHIP programs in the state. We serve one of the largest regions in the state. We are always available to provide information and education upon request from any community in that region who is interested in getting that information. Jessica will be sending out some flyers for our upcoming Medicare presentations where I provide in-depth information about Medicare, how it works, what it costs, how to get it, and then all of the insurance options available to go with it. I have presentations that are broken up into 4 parts over a 4-week period so that you can get a lot of in-depth information. And I will be starting a new session both in May and June. So I do have some flyers that Jessica will be able to provide to people who are not here in person. Our office under the SHIP program, we also act as the Senior Medicare Patrol program for our region as well. And that is the fraud program through the Medicare SHIP entity or SHIP service that provides education on how to detect, report, and protect yourself from Medicare and Medicaid fraud. So we do outreach and presentations throughout the community for that particular problem. We also are able to assist people when they suspect fraud or abuse with their benefits. And sometimes those kinds of cases can go all the way up to the federal level, depending on the severity of the situation. What else can I say about this program? Again, we are one of the highest volume offices in the state. Last year, even during COVID, we served over 1,700. We had over 1,700 contacts. I did 31 presentations, public presentations with almost 1,000 attendees. And that doesn't even count the educational presentations I did for local community partners, such as Department of Human Services within some of those counties as well. Any questions?
You can't read my lips. Questions? Yes, go
I have a
ahead.
question. You mentioned that you give advice. Now, that's not income limited, is it? If someone calls and needs some,
Absolutely not.
Concerns?
Our services, again, we're federally funded, so we do not charge for our services. We do not endorse any specific insurance companies or products. We don't sell anything. So we are true consumer advocates that are able to answer any questions from anybody about Medicare.
well, I think that's nice. And, you know, just as an old person myself, I keep getting things in the mail. And my neighbor and I both got one of these. One was really addressed to my late husband who died 2 years ago. They get mailing lists apparently from,
Yeah,
and it was like call and, you know, all this. And I just think that could be fraud. I don't know if it is or not.
well, and that's one of the things that we are more than happy to help someone with. Obviously, marketing and advertising for Medicare products these days is pretty prevalent
Yeah.
in all forms and fashions. And a lot of it can be confusing or misleading. And there are a lot of rules in place regarding marketing of Medicare products, but sometimes it's hard to tell what's
Well,
legitimate and what's not. And
It's really weird. In fact, the other day, I have a daughter that just turned 60. Well, she's she hasn't lived with us for years. Of course, she's been married, lives in Virginia, and she got something at my post office box.
Really?
So they're getting lists of,
Yeah,
you know.
it's really a big business right now. And so
Okay,
it makes
well, I
it
thought
all
it
the
was-
more important to be educated about
Yeah.
what's legitimate and what's not.
And when you give your presentations, you go in person to places or?
In
That's
the
hard to-
past, pre-COVID, I absolutely did. I would go, right before COVID hit, I was going to all the libraries in town at least once a month and providing this presentation. As time has gone on, the presentation tended to get longer and longer.
Yeah.
So that's why we decided to change it up, and we've broken it up into 4 parts over a 4-week period
Oh,
so that
that's
I
good.
can provide more comprehensive information, but in smaller chunks. And right now, we're just still only doing those online by Zoom.
Online, yeah.
I
Well,
hope that at some point in the future, we'll be able to go back to in-person, but I'm not sure what that looks like or when.
You never know, do you?
I
Well,
can- I
thank
can
you.
hope.
Thank you very much.
Thank you.
Any other questions?
I had a question. Roma, thank you for being here and sharing what your agency does. Appreciate that. What is the biggest misconception about Medicaid, or the most common question that you have that we might be able to share with people we meet?
About Medicaid.
Right.
So, yeah, Medicaid, probably the biggest concern people have about Medicaid is that if they apply and are approved for benefits, the state is going to take their house. Because it's financial assistance basically for that program. So, you know, a lot of people are leery of government assistance. Sometimes that's the issue. Some people are afraid that, you know, if they take advantage of benefits that they may qualify for, that the government will come back after they're gone and, you know, take their house from their heirs or whatever. But I think a lot of that is just misconception. The programs that we can help people apply for specifically related to savings in regards to Medicare, those are actually federally funded programs and not state funded. And so even if Medicaid did do those things, which they really don't, it wouldn't apply to people with Medicare who apply for the assistance programs that we help them look at. Because again, it's federally funded assistance and not state funded. But and a lot of people are not understanding that they can have both Medicare and Medicaid if they are low income.
Thank you.
Any questions from those on Zoom?
Bill Bowles, Park County.
Go ahead.
Do you have provision for people to do this via the phone or by mail so they don't have to come in?
We're absolutely happy to talk to people over the phone, by email, by Zoom. Yeah, no, we don't require in-person attendance by any means. And we have currently 4 full-time counselors and a couple of volunteers. So someone should be able to help you over the phone with whatever questions you may have at any time.
Okay, could they please publish the phone numbers, et cetera, for us out here?
Absolutely. I'll make sure Jessica gets you that information.
Thank you.
Thank you.
More questions? Well, I have a question. A couple things. I quite often come across people who confuse Medicaid and Medicare.
Yes.
And that's one of the most common misconceptions I've run into. And the other thing I've seen is that there's lots of insurance companies that sell Medicare Advantage plans or Medicare supplements or both. And as Anna was saying, the marketing makes it sound like that call us where we will advise you. And it sounds like what I need to do when people ask me for my advice about it is to tell them to call you because your organization will be the unbiased.
Absolutely. And that's the whole point of this program. Again, we don't sell anything. We don't endorse any specific companies or products. We provide education so that people can make the most informed decision. So we will help people understand the difference between Advantage plans and supplements and the pros and cons of Advantage plans and, you know, just everything that's out there so that they know what they're looking at when they're looking at it.
And what we can do is help them understand the difference between Medicaid and Medicare too.
Yes, and that is, I agree, that is a pretty common misconception. And that is certainly information that I go over
Mhm.
during my presentations, just to make sure it's clear. But the best rule of thumb between Medicare and Medicaid is Medicare is federal benefits that you earn over your lifetime. Medicaid is based on financial need on a state level.
Now I see that there's some lunch and learns scheduled with Pikes Peak Library District.
Yes.
And there's also a 4-part Medicare series coming up. And so are
Yes.
those are ones that your group is
Yes,
supporting?
those
Okay.
are the presentations that I'm doing right now.
And all of this is available, more details about where and when is online, I assume.
Yes, both
Okay.
on our website under events, or there are some flyers printed on the table. And again, Jessica will make sure that that information is also sent out to those not here in person.
Wonderful. I think if we all have the phone number, watch out. You'll get more phone calls.
That's okay. That's what we're here for.
Any other questions for her? Thank you so much, Roma.
Thank you very much for your time.
Next up is our favorite Jessica, our second favorite Jessica, our first favorite Jessica.
And one of the Jessicas. Okay, Jessica McMullen, your Policy and Communications Manager. I am here to give you guys a quick legislative session update. We are in the absolute final run of it. It actually ends not next Wednesday, but the following Wednesday. So everything is running in high speed. And when I say that, the House and Senate were both told, stop making weekend and evening plans. In your agenda item, you've got a list of the bills that had been reviewed by the Legislative Committee and that we had taken a position on. You will notice that there was a letter of opposition to the collective bargaining bill. At the time that we wrote this, that bill had not been introduced. That bill was actually just introduced on Monday evening at like 8 p.m. and was already heard today at 1:30. Normally, there's about a 2 to 4 week delay between being introduced and heard for those of you who aren't normally in the legislative world. So when I say we're moving in fast forward, I truly do mean it. As always, we do provide you the link to the legislative tracking site. That stays up to date on what's happening, where we are, where the bills are, that PPACG has taken a position on. Did anybody have any questions about any of the bills that we have taken a position on? Have any bills that you wanted to know if we've reviewed since this? Have any bills that we should be looking at? Or Anne has been attending a lot of our legislative committee meetings. If she wants to chime in on anything, does anyone have anything they've got for me?
Well, I'd just like to say, I really appreciate the fact that I can tune in. It's at 8:30 every Monday on Zoom. And it's just a committee made up of some of the directors, right?
It's all board members are
All
voting.
board directors. And so they review all these and talk to the lobbyists that the PPACG has in Denver. And some people go up and testify personally for these legislative things, which I think is wonderful. You know, the county commissioner from Teller, people, you know, really do this and keep up with it. And I've been very interested in much of it, but I'm particularly been interested in all the forest fire mitigation things they're trying to do because of the mountain area where I live. And so it's just fascinating. I would encourage everybody, if they've got the time, to tune in and do it. They don't meet for a long time either. There's pretty bing, bing, bing. And the legislative lobbyist man, what's his name?
Dan Jublan from Cherry
Yes,
Creek
Dan.
Strategies.
Well, he's really on the ball and knows all the legislators, our own representatives from this county and others. And so anyway, it's amazing. I noticed on the list that you had for today's meeting, you have more bills than they had discussed Monday. But like you said, it's at the wire now. I don't know what they're gonna do. It's really backed up. There's a lot pending. So that's interesting. Thank
And-
you, Jessica, for all that.
I'm very glad to help. And I'll add on to that. We're anticipating about 100 additional late bills being dropped. Yeah, that's obscene. That is unheard of.
Jessica, if the committee has not looked at Senate Bill 22-215 yet, Infrastructure Investment and Jobs Act Cash Fund, I would encourage the committee to take a look at that. It's to create a cash fund for non-federal match funding requirements for infrastructure projects eligible for federal funding.
We actually did just look at that on Monday of this week. For those of you who may not have been following it, the Federal Infrastructure and Jobs Act, IIJA, is providing a lot of funding that's accessible to local governments, municipalities, and even in some cases, nonprofits. But that money all requires a local match because it's federal money. That means a local government, to get money from the feds, has to find money. This bill would let the state provide that local match there, which is really neat. The committee looked at it on Monday and is monitoring it. There's some concerns that all of the funding through this bill is actually going directly through the governor's office. And that was one of the concerns, is just at this point, the potential for it to have political direction behind who applies for the funding and is given it. So we're monitoring it because it's such an important bill. We've been very engaged actually on IIJA, running workshops for the local governments, technical teams, and for board members to know what it is. We've got a website going that's all the grant funding opportunities with information on it. So we've been really engaged on that.
I'd just like to mention too that Green Mountain Falls, actually, I've just applied to be on their planning commission. So I'm real interested in all this, and I have been for all my life. But so I always go to the trustees meetings and so forth, and they were responding to something that the PPACG talked to them about, helping to get grants. And I was really glad that I could kind of be there too, to tell them what it meant and that it was good, because it's confusing to our little governments. And so anyway, you do a good job, and that's going to help, I think, if it ever gets off the ground, who knows?
Any other comments or questions regarding the legislative update? I guess not. So next up, Tri-County Study Update, Jason O'Brien.
Hello, good to see everybody. I'm going to try and share my screen here if I can. I guess I need permission from the host. Got a little PowerPoint I'm going to
Jason, I'll get
run by you. Sure, yeah. So I'm going to talk about the Tri-County study, which is a transportation study of the whole 3-county Council of Governments area, as opposed to just the urbanized or MPO area, which is what we normally do on a regular federally required schedule. And while we're getting the screen sharing figured out, I'll just get into the background a little bit.
You should be able to share, Jason.
Oh, okay. All right, looks like we're in business. Okay, so the The idea for this project has been around for a few years now. It was around 2018, 2019, when our PPACG Board of Directors observed that there'd never really been an organized, concerted effort to help our rural member jurisdictions with transportation planning and studies and funding. And so the Tri-County study was developed in response to that. So just to give a little high-level context here, this is the first PPACG transportation study of this area. So traditionally, what we look at per our federal requirements is the MPO area, which is, if you look at the graphic on the right, that's the smallest boundary you see. So that area gets a pretty comprehensive plan and an improvement program, which is a funding mechanism every few years. And then also every few years, the largest boundary that you see, which is the CDOT transportation planning region, that gets a plan or a study. But the green shaded area, which is really the PPACG area, doesn't really get that kind of attention. So this is kind of a unique opportunity to do that. Like I said, it's the first of its kind, so there have been no previous efforts to build on. So we're fairly high level, and we're learning a lot because we don't have the same level of technical working relationships with our rural jurisdictions that we do with our MPO jurisdictions. So we're getting to know a lot of people, learning a lot. It's been a fun process. We really want to be stakeholders and community values driven. So, you know, I don't want to, for example, go up to Park County and say, nice to meet you. Here's what our data says you should be thinking about. It's more really focused on getting their input and, you know, figuring out what's important to them. We've been working since May of last year, and there was a check-in with our PPACG committees, including the CAC in October, I think it was. And then we'll also be returning in June before we seek final approval in July. So the goals and deliverables, what are we trying to get out of this? First, just an FYI, I know the map on the right side here isn't, it's kind of small and you can't read the detail. I'm really just showing it to give you a flavor of the regional system that we identified. It's larger and easier to read in the attachment for this item. So deliverables, kind of like the long range transportation plan that we do, it's not going to directly provide any funding. So getting into the study doesn't mean you're going to get funded through the study, although we're going to help identify funding for the projects. One of the things that we get as a regional organization pretty often, pretty regularly, is requests from member governments to support or include their projects that they want to seek funding for in some kind of a regional document, because it's helpful for applying for grant funding. So one of the thoughts was, why wait for everybody to come to us with these? Let's go out and find out what they need support for, and let's show it in our study. In the second phase, which we're about to start, we're going to go into more detail on some of the projects. So in some cases, there's a problem or an opportunity that doesn't really have a project developed to answer that yet. So one of the things the project team is going to do is do some concepts, some alternatives, some cost estimates to try to help some of those projects along. And I'll discuss that in a little bit more detail on a later slide. We'll provide a funding plan that helps identify what grants are the best prospects for these projects. So we're not just saying, you know, good luck with that, see you later. Regional perspective, you know, we've never done this before. We're learning a lot. And then lastly, laying groundwork for possible future plans. We don't know when exactly we might do more of a plan for this, as opposed to just a study, which is what this is, but we're getting a lot of needs assessment and learning a lot about where we might like to go in the future. And then I'm not going to read through all these necessarily, but I thought I would just touch on them because this is some of the really key stakeholder input that we got early on. So our stakeholders, we had some big stakeholder meetings in each county, and they affirmed our idea of keeping the focus really outside of the MPO for the most part, just because this is a unique opportunity for that, whereas our MPO member jurisdictions are going to have a regular comprehensive plan done every few years. We don't know when our rural jurisdictions will get another chance to do something like this. We're going to focus on transportation facilities like roads and routes that are not on the statewide system. because again, those get a plan through CDOT. Whoops, I'm jumping ahead of myself. There's a lot of growth in Southern Colorado. So tourist and recreation needs are rising rapidly. We were asked to look at not just traditional funding sources, but help our members get a jump on some of the new ones. And pretty much everybody we talked to everywhere said we need to do more towards improving cell phone coverage and internet service, broadband. Our project approach, just real briefly, how we decided to attack this was, so our scope was developed cooperatively with folks from all 3 counties. And it's not a plan, it's just a study. And so the big distinction is that we're not doing a project funding prioritization like we might do with some of our other documents. So there's not going to be winner and loser projects. The first phase that we're just wrapping up has been background. We did a really comprehensive, well, I would say just robust study of existing plans so that we're not duplicating work that other folks have already done. We've done about 80% of the stakeholder process, more or less, I would say, and we've developed that project list. And what we're about to get started is doing some more of that detailed development of a subset of those projects and creating the funding plan, which would cover all of the projects. I won't go through this in too much detail unless you want me to, but we've done a great deal of stakeholder involvement. And what you see, I would say, is more of a representative sample. It doesn't cover everything by a long shot. We've probably done a few dozen meetings and interviews for this. But just to break it down briefly, our core stakeholders are people we talked to several times throughout the project. And they're people that are on the county staff that really have the pulse of the county and know about the problems and the opportunities and what people are asking for. Those would be people like public works managers, county administrators, a couple of county commissioners. And then we also did wider county stakeholder meetings with some really diverse participants, from transit to trails to emergency planning to roads, pretty much everybody we could think of. And then we also had some focus groups that broke out to get together and talk topically instead of by county or by area. And we got a whole lot of input, and that's really been the guiding force behind the project. Everything has been steered and decided and determined by the stakeholder process. A few key findings so far that came out of that analysis of existing plans. There were just some common themes that came up over and over again. So I thought some of those might be worth sharing because we didn't know what we would find. We've never really surveyed what's in all of the county and municipal plans. So in the counties, managing growth, maintaining rural character, and recreational tourism opportunities were common themes that came up in all 3 counties. For cities and towns, more collaboration between jurisdictions, walking and biking, extended transit options, maintenance considerations, and things related to tourism and scenic byways were things that pretty much everybody was concerned about those things. Another area we looked at was emergency planning, just, because of the nature of our region. And, without going into too much detail on all of these, there are emergency plans out there, and they're good on a general level, but there's a pretty critical need in terms of the specific challenges and needs are not really very well documented. So there's not a very good sense of exactly what should happen in an emergency. And there's not a great level of preparation. So key transit findings. So there was a transit focus group that met. And again, I'm just going to sort of skim through these a little bit. We heard several times that longer trips are tough because they involve transfers, and that can be a little bit disorganized. So that gives people problems that need to travel a little further. People are having a tough time that are transit dependent and need to go to medical appointments or vital services. We heard many times that the paratransit was inconsistent, confused, not very well coordinated. And I know there's people, there are organizations and folks doing some good work on a smaller scale, but when you blow it up to the regional level, it starts to look a lot more chaotic. and then first and last mile improvements. And a lot of people said that we should really look hard at trying to have better east-west connectivity across the region. So a transit spine going from the westernmost portion out east, which would probably be a Mustang or a state route. Trails, there were just a couple of really endemic issues. Some of that same lack of coordination, trails are crossing multiple jurisdictions and there's not really much consistency to it. And then there's a lack of safe crossings across state and county roads. Emergency plans, talked about what we found in existing plans, and this is what we got from the stakeholder process. And again, the maps, if you want to look at them, they're larger and you can see all the detail in the attachment if you want to look at that. This is just to give you a flavor of it. There's generally lack of capacity for emergency situations on key roads. Maintenance is an issue. Some things that are just kind of a nuisance during normal times, like vegetation clearing around cell phone towers and evacuation routes, they can be pretty deadly problems during emergency times. Limited cell phone coverage, lack of coordination. So one person's detour route might be another government's only way in or out of a community. So that can be a big problem. And there seemed to be a relative abundance of grants out there, but not enough staff to pursue them. And then getting toward the end here, I'm talking a lot. Welcome your questions in a minute, but we're about to kick off phase 2, which is where the primary goal of that is, again, to look at some of the areas where there's not a really well-defined project in place that somebody wants to use for grant funding, so that the consultants, got some expert planners and engineers, can help define those projects a little better so that they're ready to be submitted for funding. And some of the criteria we used, I think there's going to be 12 to 15 of those out of an overall list of about 90 projects. So some of the criteria used for those is that they're not developed enough in their current form so they could use the service. They're complex enough so that they'd really benefit from the attention. So it's not a simple, straightforward project. It should be in a rural area. One thing I want to highlight is that there are some good projects out there for this 4th bullet, but some of them would probably be a better fit for the 2050 long range plan that's going to kick off this summer than they would be for the Tri-County study. So if there's a project in the MPO area, it's actually a stronger position for those projects to be in the 2050 long range plan than in the Tri-County study, because the long range plan has a direct connection to our funding. So if you had to pick one, if you're eligible for the long range plan, that's the one we'd suggest. And then, we checked our choices with our county stakeholders and said, how'd we do? Are these the right projects? And, we made a couple changes in response to their feedback. And now we think we've got a pretty good list, which is currently being updated. And that's it. Sorry for rambling on. Welcome your comments or questions about this. And if anybody feels, we tried to be very, I'm sorry, go ahead, I'll wait.
Bill Bowles, Park County. I wonder if you could put your slides up where I can copy them and take them to our commissioners and talk to people here.
Sure, will do. And we have, I know that Commissioner Elsner is familiar with this process and has been in several of our meetings, but I'll put the slides up and then make them available where Jessica can send them out to the group.
Thank you.
Thanks for your interest.
I have a question.
Go ahead.
Is that okay if I go ahead?
Go ahead, yes.
This is Ann Esch from Green Mountain Falls.
Hello.
And I had written to Andrew and said, I've read all your stuff online because Jessica attached it to our thing. I haven't printed it out, but I've read it and I want to print it out kind of like Bill does so we can let other people know. But Green Mountain Falls didn't go to any of the meetings, and Andrew said that they were actually invited. Although Green Mountain is part of the MPO, that and we were in big transition. You know, it's just a little teeny town but when you have those meetings, can just ordinary folks like me go? Or are the stakeholders all office holders, or who are they?
Well, they were kind of a cross section. So for example, from Green Mountain Falls, on the invite list, Mayor Newberry was invited, your town manager, Ms. Sprang was invited. There was a trustee, and I believe you were invited.
I didn't know that somehow,
Okay.
you know, which is
Yeah.
okay, you know, that. Go ahead.
Yeah, so we just tried to invite a few people, you know, the ones we thought would be interested. But, you know, and there's also, another thing is it's not too late to talk. So if there's, if yourself or anybody at Green Mountain Falls would like to arrange a chat, you know, that's why we're kind of coming to you now at this point, because there's still time now to get more input if somebody's interested. And so the only thing we're asking people to consider is whether or not your projects may be a better fit for our long range plan, but maybe they're not. So if you'd like to chat, it certainly is not too late at this point. And if you'd like, I can try to set something up with you.
Well, I think that's great, and we can email you. Is that a good idea?
That's a perfect idea. Yeah.
Because Green Mountain Falls is working hard on an evacuation plan and mitigation of our forest. You know, it's going to start this month. It's tricky. And of course, UPass is a fire trap. And we've got Cascade and Chipeta Park that don't have governments, but they're all interested. You know, they're part of the communities up here.
Yes,
And,
ma'am. I'm gonna, just in case anybody doesn't have it, I'm gonna enter my contact info in the chat here.
Okay, and I see it on your, that we looked at, you know, all the slides you were showing us.
Yes,
And,
ma'am.
well, I think that's a good idea. And I know Bill Bowles way up there in Park County, very, very rural. And he's so interested in all this. So it's a good thing.
Yeah, I appreciate your interest and thanks for reading the document. And yeah, if you shoot me an email, we can set something up, and we are interested in your emergency plan.
Well, that's great. They're working hard on it. And we only have 2 ways out of Green Mountain Falls.
That's not a lot. Yeah.
And the town has grown to 800 people. So that's a lot. Okay, thank you so much.
Thank you. Look forward to hearing from you.
Any other questions for Jason? Thank you very much, Jason.
All right. Thank you all for your time.
Thank you. Well, there's no action items on the agenda. Is that right? I'll be darned. Okay. So any member discussion?
Patty Benger, I have a couple of things I'd like to share.
Sure.
I just wanted to let everybody know, if you had not seen that the Mountain Metro Transit has unveiled 4 new electric buses. And so we're pretty excited about that. Those buses will run between 220 and 330 miles before they need to be recharged. And we got some federal funding through that, through a couple of different grants. So you'll see that it's got the artwork on the side of the bus. Will have some Nikola Tesla artwork on there, as well as some new images of the city there. So it's kind of exciting that we're moving forward with that. And then also, I'm sure you're all very aware of the wildfires that we've been having throughout the state. And so Colorado Springs Fire Department did put in level 1 burn restrictions on April 15th. And so if you're in the city, there are specific information you can get at coswildfireready.org. And that's a website that's always updated. So if you are ever wondering if it's okay to have an outdoor fire or coal burning fire barbecue or anything like that, you can find out there.
Thank you. Any other member comments?
This is Roy Rosenthal. I'm just curious how many people are showing up in person. I'd be happy to participate in person in the future as long as there are a number of people there. Are many people there?
Well, there's 4 of us members here today.
Okay,
We'd love to have you join us.
I think I'll do that the month after next. I'll be gone the next meeting.
Sounds good.
Okay.
Anything else? How about items for the next CAC meeting? Nothing? The meeting and event schedule was in our packet. Jessica, you have some comments?
I do just want to chime something in. Your packet calendar does show some of the things that are happening in June, July, and August, but it is not telling you about the last 3 classes of the spring retirement series, which are Meaning and Purpose in Retirement, Estate Planning, and Social Security 101. And those are May 2nd, 9th, and 16th. Or about the Security Public Library 4-part Medicare partnership, which are Wednesdays in May. So at 5:30 p.m. on every Wednesday in May, there's a Medicare 101 class that 4-part series really goes into detail, as Roma talked about. Those aren't on your calendar because your calendar is mostly focused on June, July, and August. So please check out the PPACG event page, ppacg.org/events, and it'll give you the list of all of our classes and give you some good information. And I'll send it to you after the meeting as well.
Thank you, Jessica.
Jessica, last month, I'm trying to remember, there was a presentation on the Family Caregiver Support Center. And I feel like we were going to get some follow-up information that we could share with others, a flyer or the PowerPoint presentation. I'm sorry if I missed that, but would you mind sending that out again?
I would not at all. I'll send that on out.
Thank you.
And the Family Caregiver Pampering Day is this Saturday. So registration is closed, but we're going to be pampering 70-some family caregivers who have been putting a lot of their time and energy into taking care.
No more on event schedule? Well, I forget, do I need a motion to adjourn? Oh, goody. We can just say the meeting is adjourned. Thank you all for attending and come in person if you can. Bye-bye.
Thank you.
Bye.